Welcome to Be the Exception podcast. We are actually here with my brother, Clay Raleigh, who owns and runs OptiLife Medical. And we're going to kind of talk about a lot of different stuff across the board, but a lot of you guys out there that need to learn on how to optimize your health is ultimately what all of this is going to be about, from a standpoint of the everyday human being to a competitive athlete, but you're not competing in anything sanctioned that you're like worried about that you would fail a drug test for performance enhancing drugs. And then we're also going to talk about what the side of that where, you know, stuff that you probably could use that is 100% legal. And then for those people that are always like at the, you know, top or always skating the line, or those that just try to get by the stuff that they might be taking that they get around drug tests on. Just, you know, this is for information for people to understand. Not that we should tell you to use a lot of this stuff, but there are things that we're going to tell you that you probably should be using or doing to help you be healthier. But Clay, can you let's start kind of like with your background. So, I mean, I obviously know it, but most people don't. Just kind of like where, like your background, where you came from, and then what kind of led you into this area, because you are a nurse practitioner by trade. So
Right. Yeah. So thanks for having me out.
You're welcome.
So first piece is just from, childhood, essentially. I'm formerly an athlete, retired athlete, but played college football, had all the injuries. I've had 2 shoulder surgeries, and then, obviously just various degenerative disc disease, things like that. But, I played football my entire life. I went and got my nursing degree, and I worked in the emergency room for 4 years, and then had various experience in aesthetics, as well as ortho spine when I went back and got my nurse practitioner degree. So very well-rounded. I currently work in, I do urgent care, but then I also run my business as well. So pretty well-rounded in that aspect. So basically, the way that I found kind of this field of regenerative medicine is once I, stopped doing sports and, just continue to weightlift, things like that, I really noticed that I was starting to have low back pain working 12 hours in the ER. And, I started to have this hip pain. And so obviously as a, athlete, you start to make those excuses, right? You're like, oh, I just, I went too hard on squats, or I ran too far, things like that. But I was having this referred leg pain when I was 26. I'm 28 right now. And I was like, 3 months went on of me stretching, foam rolling, lightening up squats, doing different various exercises, focusing on mobility. And obviously with some of my medical background, I'm sitting there trying to diagnose myself. And then I was like, okay, like, this is probably sciatica. For those that don't know about sciatica, is, you have a herniated disc, and then you have pressure on a nerve. And it just kept sitting mid-thigh to the point where I couldn't sit in my car longer than 15 minutes just driving to work. I worked at Northside Cherokee Hospital, and from my house to there, it was a 7-minute drive. And just getting in my car to there, my leg would hurt. And obviously, mentally, you start to think about the day when you're already in pain. So that's tough. I won't go too much on that, but that was kind of the spark of the regenerative medicine process is, I had this pain. And so I went and saw orthopedic finally after, some time of dealing with the issue. Went and saw orthopedic spine. He didn't necessarily laugh at me, but he was just like, you're a young, healthy, fit, male, I'm not operating on you. I'm not, he said, you're functional, you're doing this, that, and the other. Not that surgery is always, the goal there, but it was more of like, what have you done? PT, chiropractic, stretching, mobility, really focusing on my recovery. And again, this was originally before I was a nurse practitioner. And so I listened to him, respected his opinion. I'd been taking Advil and Tylenol. I'm not a huge medicine person myself. I mean, don't get me wrong. I'll take, I'll take Advil. I'll vaccinate my kids as well. But because I know that's where somebody's mind went. But
the unvax man,
yeah.
Fuck his kids.
I believe I'm not trying to have my kid have some fucking polio or some shit. But anyways, I'm not somebody who just like turns to, Advil or Tylenol, great uses, but I was already doing those things. He said, keep doing what you're doing. And which is frustrating because as a high performing former athlete, right, keep doing what you're doing. It's like, well, I have been, and I'm not happy because I'm not able to, be at my optimal state of health, right? I'm active. I like to, if I had it my way, I would do 2-a-days every day because it feels good. It's fun. I like the mental health aspect of it as well as physical. So if I had the time and the recovery, I would have done it at the time. So took that advice, went and got a second opinion, went to a neurosurgeon. So again, for information, if you are dealing with spine, my own personal opinion as a nurse practitioner is if you're dealing with spine or nerve related, see neuro. Just their education's a little longer, and obviously that's what they focus on. Ortho and neuro, they're both great aspects, but if you're having a spine issue, my own personal opinion, if you're
see a specialist.
yeah.
Like don't go see mom and pop down the fucking street and they're like, yeah, did you take this? Did you do this basic shit? Because they don't know and they're trying not to tell you without telling you.
Sure. And to preface this as well, the ortho did order an MRI, so I had a confirmed L5-S1 disc herniation, which is if there's going to be disc herniations in anybody, like you guys probably have some form of herniation in your low back if you lift. Like that's just it. So saw neuro. He pretty much said the same thing, but I did appreciate him. He really was like, I get it. He's like, I used to deadlift, blah, blah, blah. I can't my knees. So just kind of adjusting. But again, sparking the interest of, I'm like, dang, that, getting older sucks. Injuries suck. But it's like, I want to perform. This is what, a lot of this brings happiness to people's life. So I was like, this ain't it. I'm not going to keep taking Advil and Tylenol. So I started doing my own research. I had even mentioned growth hormone to the orthopedic, and he just looked at me kind of sideways because, respectfully, I mean, in our education is very Western medicine is, it's great, amazing medicine, but it's, it's not as well rounded as like it could be. Obviously, if you're educated in different disciplines. But long story short is I started doing my own research. I really found peptides, and one specific one that I found that is still my favorite peptide to this day, for various reasons, is I started taking a peptide called Samorelin. Samorelin is a growth hormone analog peptide, very safe. Half-life of the medication is 15 minutes. Basically, since we're talking about peptides now, peptides are an amino chain acid essentially that sparks a natural process in your body. So we're talking about growth hormone here. This is a hormone that will decline as we age, just like anything else, slows down as we get older. But the reason why I stumbled upon that specific peptide is because growth hormone is one of the major hormones as we're younger that promotes collagen production, joint inflammation, decreasing joint inflammation, sleep, recovery. So my thought was, if I can increase my recovery to an optimal level, then maybe, again, theory, maybe my inflammation in my back and my sciatica will go away. So that's what I did. I did the therapy for, I believe I stopped after 6 months, but had originally committed to about, 3 months, and noticed, I was like, wow, I'm getting really good relief. Essentially my pain went from just resting from a 6 all the way down to a 2. And then, did various research, continued, to see how long I could take it, went up to 6 months. And I mean, I'd show you a video if I could, but, I can, which is my optimal level is I back squat 315, 4 sets of 12, slow and controlled. With, I mean, don't get me wrong, I'll be stiff, but I'm good, comparatively speaking, to where I could not finish my 12-hour shift in the ER. So that's a little bit about my background and how I kind of found peptides. Obviously that was my introduction to it. And I was like, this medicine, it's not talked about. It's not regulated by insurance. It really sparks a lot of questions, why and things like that. But I knew for me as a patient, I was astounded. And I was like, this is, unbelievable, to where it was able to get me back to where I was. So huge benefits.
Why do you think like peptide? Well, I guess for people that don't understand kind of like what peptides are and why do you think they're not as readily available as so you go to a doctor, right? And you're like, okay, so this hurts, and you don't really know anything. You're just listening, and they're like, yeah, you should go get a cortisone shot, right? That's the typical thing a doctor would tell you. And and someone's just like, well, I heard or was told like about peptides. Like, what do you feel like? Why does it not go with a doctor saying like, hey, this is probably another route you could take?
Right. That's a really good question, and there's a lot of different answers to it. I think specifically speaking as myself as a provider is you know what you know, right? So if you're not trained in, multiple disciplines, then, you're not really going to necessarily think in one avenue or another. The other is truthfully, it's insurance. If you're like if I'm an orthopedic and I'm like, hey, you should take peptides. They're not, that orthopedic is essentially wasting their breath financially because ultimately not saying that, providers recommend things that you don't need. That's a different conversation for a different day. But, if I'm an orthopedic, this is, again, speaking from a patient as well. I came in and I was having the pain and they recommended a steroid injection. And I followed through with it. But insurance can bill for a steroid injection. Therefore, the provider will then get reimbursed for the steroid injection. And they even tell you, they're like, it may work, it may not, you may need 3. There are side effects, but this is what I got. And again, there's 2 main reasons is one is the financial reimbursement aspect. And then the second is also, your swim lane. If you're educated in what if you don't have that experience as well as you're trained in those other disciplines, you can't necessarily recommend from coming from a full environmental, aspect. And the other thing is like simply to touch on that is, well, how's your sleep, right? How's your sleep? So essentially they're going to recommend what they, A plus B equals C. We're trained in, we're educated in algorithms. You present with this, we treat with this, and then this is the result. And then also the financial reimbursement aspect is, my opinion, the main reason.
Probably the biggest. Yeah. I mean, at the end of the day, they want money. Everyone. So they're going to push you towards also like, would a doctor have like repercussions for saying like, hey, like from a medical standpoint for them, if they were like, hey, you should probably use this peptide, they can't recommend it because they're not, well, some are going to become FDA regulated from what I understand, but a lot of them aren't.
What do you mean? Repercussions like from a job standpoint or like?
I mean, yeah, because it's not something it's not like they're necessarily covered. That's medicine that's outside of their realm technically, right?
Good question. Yes, I would imagine in theory. So yes and no. So say for example,
could they get their like license taken?
No. No. For example, I will work in urgent care, and if I'm not going to sit there and start talking about peptides to patients that are coming in for a sore throat, positive strep test, they need, antibiotics, whatever. I'm not going to sit there and start, talking about peptides unless they were to ask. But if I just had like a genuine, conversation, there are people that are well versed in peptides now. It's becoming more, I'll sit there and I'll talk about, oh yeah, I have some experience, X, Y, and Z. But so on that aspect of, yeah, you should try that. You could try this, and then you're honest with them in terms of research, stuff like that, you'd be fine. But if I was, we'll say, an orthopedic surgeon, for example, and you're coming in and I'm, say for me, he was like, you don't need a steroid injection. You need BPC 157. He's not going to get reimbursed
right.
on it. Eventually the higher ups are going to be like, your numbers look horrible. Why are you not doing this, and this? Because a lot of people don't. I mean, maybe a lot of people do know, but medicine is also a business. We are, we're educated, obviously, but if you work for a corporation, just like anything, if your numbers aren't performing, and say, I saw 100 patients, and essentially I was like, you should be doing, peptides or, going and seeing, chiropractic or things like that, and I'm not billing you for a procedure, you're going to get a call from administration. You're going to be like, hey, what are you doing? So you're not going to get your license revoked, but they're going to be like, if you have, Sling and Sam that's like, you need a steroid shot, you need this, you need that, and it's all billable procedures, and they're cranking out surgeries, then he's not getting a call. He's getting a raise and a high five and a slap on the butt. That's what he's getting.
It's so fucked up.
Hell yeah!
I mean, it's
send them through the assembly line.
And to clarify, not everybody is like that. Obviously, there's moral ethics, but it is So that is, it is a business. Like if you actually take a step back and look at it as a whole, the same, again, not crapping on antibiotics. I think antibiotics are amazing medicine. And we've also seen in the last couple of years how you feel one way or another about vaccines. Vaccines is a billion-dollar industry now. There's a lot of greed in the world. So I'd like to get off this topic so this doesn't turn into like, this guy. But but as you can imagine, form your own thoughts. But to circle back to your original question, no, I do not believe you would lose your license, but there is the business aspect.
Mm-hmm.
So you might get a talking to.
Right. So like most people, if they've gone through kind of like what you did, right? You went through. I've also went through it. I went through when I was 23 years old. I went in. I knew a nurse, and I was like, I just don't feel good. It's weird. It's not like I feel depressed. I just am like, I'm exhausted no matter what I do, what I eat, anything. And I went in and got blood work done, and they're like, yeah, this, and this is low. And like, for instance, one big thing, like, of course, for males is like testosterone, stupid low. But they're like, look at you, you're fine. And I was like, but I feel like death. And I was like, is there anything you can do? And like most of them were like, no. And unfortunately, like being a competitor with a sport, like you are bound by like drug testing, like I'm not allowed to do things, unfortunately. And I like, it sucks in a health standpoint, right? But like I like to compete. So the day I'm done, like I'll start looking more into that. But unfortunately, like all of these doctors, they sent me through a nephrologist, which is for like kidneys, right? Like one doctor was like, yo, you're gonna have renal failure, your kidneys are gonna go. And I'm like, what? I'm like, or I just work out a lot and have a lot of creatinine, which my body basically muscle breakdown, right? So that bro, I just work out way more than anybody you've seen. And then I eventually went to, what's what I'm leading to, is like a functional doctor for functional medicine, which is essentially what we're talking about is functional medicine, where it's not along the lines of that assembly line of understanding medicine. It's a different way of thinking. And they're like, yeah, like, no, your kidneys are fine. Yes, like, unfortunately, you can't use, there's stuff we could do, but we can't do it until you're done competing because it will fail on a drug test. So, like, you can't do that. So what are my options? Well, it was like, take more vitamin D, make sure you're getting the right amount of sleep. And that was ultimately the reason I went in, is like, I couldn't sleep for more than 90 minutes at a time. I was just too hot. Like I would wake up and I just couldn't sleep. And honestly, regulating my sleep became what fixed a lot of those issues. Once I was able to do that, like I was able to recover, because sleep is ultimately the biggest issue for recovery. If you can't sleep, your body's not repairing, which is essentially deep sleep. And like another great opportunity, like to listen to somebody on this topic, was like Andrew Huberman. He was like, take valerian root and use like tart cherry juice, which is the whole sleepy girl mocktail situation that's running around the world right now. Which all tart cherry juice does is help you produce more melatonin instead of taking a bunch of melatonin to go to sleep, which I don't think a lot of people know, but like
it's bad for you.
Not good for you to take. Your body releases small amounts of melatonin at a time, and like people go and take like 10 milligrams of melatonin in your body, just like, what the fuck is
or more,
happening?
because the gummies taste so damn good.
Well, that too.
They are good.
Right? But
they are good.
Like, so ultimately, like, wrapping that back is like, for like functional medicine, most like that's where like people would probably need to go look for it in a doctor, and is essentially what you do,
right?
And it's health optimization. It's what, like, some doctors, they take a risk because a lot of times they go with like, it's not insurance,
right?
And everyone has to have insurance.
So
you have to, whether you get a fine on your taxes.
So fucking dumb.
Which, I mean, yes, people, please, like, don't not have insurance, because if like you go to the hospital and your bill's $50,000, you're fucked. Like, don't do that. But like, the point is, there are reasons to go to certain doctors, and there's reasons to go outside of that, right? Like,
well, to highlight two pieces for the audience about what you had said specifically in your case, and I know a lot of people can relate to this, is, you said you had an elevated, renal function, and that doctor saw it and came back and said, hey, they were concerned about your renal function. Now, I don't know who that doctor was. I wasn't there in the room with them. But if he was an athlete, for example, I'll speak for myself.
Right.
I've been an athlete my entire life. My BUN, which is a measure of basically waste excreted by your kidney, my BUN is always elevated every single time I do my blood work. But I typically will work out. I work out every single morning, but then also too, you're constantly breaking down muscle. So mine's chronically elevated, all minor, very minor. So at quick glance, someone could be like, "Oh, that's concerning." But again, had you have seen a provider like myself, I would have been like, "That's normal." You look at other aspects, like you can look at your kidney filtration, you can look at creatinine. You said yours was elevated, but the important piece is you came in and you were seeking help because you were not feeling at everybody's threshold is completely different. Like I can't compare myself to you and you can't necessarily compare yourself to me in terms of performance. So that being said is they look at a range specifically, and keep in mind their mindset is more of safety, which is super important. That's honestly the first thing that it should be. But that second aspect of, okay, well, he's not where he should be. He's not feeling at a specific level. Someone that is very, the provider you seek out that has a little bit more of maybe your background from a performance standpoint. The majority of us as athletes in the room, we're not the average human being, although we crack jokes like we're average. There was some statistic about like the average, I think it's like 35 and up, like can't run a mile, which is crazy, like in the world, like actually sit there and run a mile consistently. So, right. So if you're
I'm a fat sack of shit and I can still do that.
But if you're going to start talking about averages, right, average,
Dan just leveled up today.
Yeah, you're not average. And so it's very important to find a provider that's able to, hear you and then also have the ability to, get you to your optimal state versus, okay, you're within normal limits. We don't need to do nothing. And then that's it.
Right. So like, essentially functional medicine, the basis of that is looking, like you said, you can't compare me to you. Everyone's different. Like their normal medicine is based on averages. So functionally you're looking at, okay, yeah, that's fine. But like, what's your average? Where are you supposed to be?
Right.
And I like, that's kind of what I've understood from when I've like bounced around trying to find people that are willing to help, and look to make you, like happier. Wellness is happiness.
Right.
Like health is happiness. So if you're not healthy, you're probably not happy.
Right.
I mean, actually tell me one person that's not healthy then. like that's fucking not happy. Like
running through people.
Yeah, right. Like, I mean, there's just like, no, if you're not healthy, you're probably fucking pissed. And if you're not, you're mad at everybody else in this world.
Why are you looking at me?
I've been looking over here this whole time. Time to switch sides.
Yeah.
And it just happens to coincide with being fat and unhappy. Got it.
No.
Thanks, man.
We just said you're above average. You can run a mile. Which is bad.
That honestly is pretty fucking crazy to me that the majority of people 35 and up can't run a fucking mile.
Yeah, don't quote me, but that was.
I mean, if it's a statistic, I'm not.
Correct.
Then it is what it is. I guess not quoting you. That's we'll put the article in the description.
Yeah, there you go. And then put my address in there so people can show up and throw rocks at my
hate mail.
Damn, man.
Hate mail.
You're not saying, honestly, Clay, like, you're not saying.
If you're showing up to the house, prepare to square up.
Yeah, I mean, that's fine. Yeah.
You're not saying anything that I think people would. Like, you're not talking about being transphobic or anything. So like, I think good. That would get rocks thrown at your house, especially around this.
Yeah, I'd probably judge the caliber of strength they threw the rock, and I'd be like, I got a peptide that can. It's hard to get leads, man.
Shit.
Oh my god! All right, so because most people here's another point is like a lot of doctors can prescribe synthetic hormones, essentially testosterone, estrogen.
Progesterone.
Yeah, all of that, right? So kind of like for people that don't know much about peptides, because they've actually been around for a long time.
Right.
Like what, 80s, 70s?
Yeah, Samorlin was originally studied in the 80s on growth hormone deficient children.
Right. So like it's been around forever, but like it's now this forefront thing that everyone's
Wait a minute. Something good for you is just now becoming known,
like,
and it's been suppressed by the government for a while.
let's do it. Conspiracy theory.
I don't get it. Help me understand more.
Go, Dan. What's the conspiracy theory here? Money? Is that the situation? Money.
Pharma. No,
So like, if they're able to like prescribe that, you know, like what's the difference? Like, what is the difference for people like for what they would prescribe as like testosterone versus a peptide?
Good question. So, simply put, the reason you'd get prescribed testosterone, so we'll say you're a dude and we'll just use a number, you're 35 and your total testosterone is below 300. Normal range for men.
All right, we get it. You're talking about me. Keep going.
Okay.
That's kind of fucked up. That was like the exact scenario.
The average.
Fuck.
Not using specific examples in the room. Total test is, again, on paper, range, 300 to 1100. For those that don't know, that
for
is
men. For
men, yeah, that is a big gap.
Holy shit.
Correct. So say your total T was, below 300, you'd come in and you'd see a provider. They put you on testosterone. That's a billable procedure. Again, that is, they will get reimbursed for that. Now, if you came in and say you were to see, a doctor, they're not going to recommend peptides for two reasons. I mean, unless they're well versed, and then two, maybe if they don't want to, they take a step back, which this is a common scenario for me. I'll have people that will come see me and they're like, I want to be on testosterone. I'm fatigued. Now, you can look at that number and you could, I could justify, okay, yeah, your threshold maybe you're optimal at 900. I mean, majority of people would be, but maybe that's your optimal. But you take a step back and then you'll look, okay, well, how's your sleep? Have you just had a kid? Did you just have a job change? Stress will literally plummet men's testosterone. Very, very sensitive, actually, to the stress. But
that's why men are trying to not to give a fuck half the time about things, and then they just get fucking just destroyed by somebody else.
They're just trying to raise their. They're just trying to raise their teeth. That's it. Yes, that would be the reason that they would prescribe that is finances, the financial aspect. I think that's what you asked me.
Yeah. Well, so like, what's the difference essentially in the body? Like what?
Oh, got you.
For people.
Yeah, to put it as clean cut and dry, peptides are amino chain acids that will promote a natural sequence in your body. So period. Synthetic hormones, for example, testosterone, that is exogenous, so basically
outside of the body,
coming into the body and then synthetically raising those levels. Caveat to that is, if I were, as an example, if I were to say I started right now, it's like, okay, I'm going to start taking testosterone, and I started taking testosterone, and let's just say my total test was 350, right? So I can get my test up synthetically to 1200. You can take a blood test and see my testosterone went to 1200. Now, say next week, I lost my vial and it broke, hit the ground, and I didn't have any more testosterone. Since I am exogenously putting it into my body, our body essentially will, just slow down production, because inside the body, it's like, hey, we're optimal. Like, our test is high. But it's fake news basically inside the body. So then, the testes will be like, we don't have to work as hard. We're going on vacation. So if I stop taking tests after a week of being on it, of being 1200, I'm going to drop down to like 150, because it's on a negative feedback system in our body. Going back to peptides, you don't experience that because it's following the natural process in your body to just basically just come in there and almost coach and be like, hey, let's be more productive. And it follows your natural, the natural cycles. So when you stop peptides, you will eventually return back to baseline, because essentially you feel like a superhuman. Recovery is better depending on what peptide you're taking, but you're not going to have that rebound, and you're not going to have that catch-up period where your body's like trying to figure out like, hey, what the heck just went on, basically. That's the easiest way to kind of put it. And that's why it's so attractive for people to take peptides, because you can honestly come and go as you please. There's not like a post-cycle therapy you need to take. Like,
which is what most people need to do for synthetic, right?
Correct. Yeah. And the side effects are minimal, like I had originally stated, was you look at half-life. So again, comparable, we'll say Samoralin. And again, they're working on two different things, two different medications. Samoralin's half-life is, 15 minutes, like max. So it's not in your system. Go ahead.
What do you mean by half-life?
Yeah, what half-life means is essentially from the time I put a medication in you, is half-life is basically 15 minutes. Half that medication is already out of your system.
Whoa.
So Samoralin essentially would be out of your system in 30 minutes. Again, don't quote me on that exact time, but it's very
sure.
small.
It's just giving an example. That's fair.
Correct.
Yeah.
Testosterone, for those that don't know, one of the most common ones is Test-Sip, testosterone cypionate. The half-life of that medication is 8 days. So it's half of the medication's in your system for 8 days. Now, very, very useful medicine, but in terms of, if you start to think about it from a science example, when you have something that's in your system and it's suppressing other things, again, testosterone is great med, but that's just kind of the science there. So
I gotcha.
Peptides, are sending your own natural process. You don't have that suppression. And then, synthetic hormones. And again, if now say I had a 70-year-old dude and their test is like 50, who at that point it's already suppressed. Run it,
Yeah.
So that's my thought there. It's like we're not getting any higher.
So it's not like once you crack the vial open, you stab a needle in there, get your first draw, it's going to be dead in like 15 minutes once you put it back on that shelf. That's not the half-life.
No.
There are people who genuinely believe that. Just that's why.
Oh, no.
That's why I'm saying that.
No, like you're saying, like once you puncture the medication, or
that's what I mean. That's why I know what half-life is, just for everybody else.
Got you.
Like that's
not to be mistaken for shelf life.
Yeah, I've had conversations with people who are like, no, once you have to figure out a way to reseal it. I'm like, what are you talking about?
No, that's not what we're talking about. We're talking about the body's ability to metabolize.
Gotcha.
To metabolize the
that
medication.
One. People who argued with me, it's fine. Bill's scared.
Yeah. So all right. So next is kind of like. I think a lot of people might want to understand and know is like there's a lot of like information out on this now, and everybody's an expert. Everyone's got their own opinions about stuff, and like there's so much misinformation. But there is misinformation about everything on this planet. Where would people like? Because again, I would assume like this is my thought for most things is like always do your own research.
Right.
Like just because we're talking about this, like go and research all of this yourself too.
Right.
Make sure that everything we're saying is on track. Right. So like how do people navigate like understanding like what information is true or not about most of this stuff?
Yeah. And I agree with you. Although this is the age of information, it is also the age of misinformation. That's just a name of the game where we're at in society. But I would say that kind of first piece for somebody that were to be listening to this is if you have honestly word of mouth for if you're just like a general citizen and you feel like you have a trusting friend, mother, father, wherever that's like, hey, I met this guy named Clay and he helped me with X, Y, and Z. These are, this is kind of what I did and I recommend him. So I think that for a lot of different aspects is if you have a referral from a trusted friend, and you're just a general citizen and maybe you're not on social media and you don't see these things. I think that's pretty safe. The same way you get a referral from a roofer. Hey, they took care of me. Second piece is it's very hard to find, say you found me on the internet. I have zero social media, zero. I don't, all the patients I take care of have been word of mouth. It's very difficult to kind of vet people. I think vetting the provider and doing a, good in-depth research as well as, sit down and have a consultation with them and, what are your credentials? What are your experiences with this? What are the results you've seen with this? What's your approach? You get blood work. You just kind of have to really take care of yourself first before you present it to somebody and get multiple opinions. I've had plenty of patients that have come to me that have, said, hey, what do you think about this, and this? And I'm like, do your own research, but then also, get a second opinion. Like, you don't need to, I'm not saying that you need this, but I am recommending based on my, medical professional opinion. So kind of answering what you're saying essentially is you want to try to do your own research specifically on that provider, and then don't always just trust everything that you see on the internet, which is seems like common sense, but I have a ton of, again, flip side is I will have consults with patients that will vet me specifically about like prices. And one thing that's different about what I do that others will do, like peptide consultants or research peptides, is I am using my medical license to prescribe these medications, and they are coming from a compounded pharmacy that is regulated by the FDA, sterilely compounded, things like that. So I can't compete with Jim that's just essentially giving you a powder in a vial and saying that it's this. And it may be legitimate. I'm not saying that it's not, but I can definitely back up where my product is as potent and as efficient as possible with no additives, and for various reasons. So in terms of like pricing, for example, people are like, semaglutide, $50 a month, right? Like, how can you prove that that's semaglutide? If you're getting it for $50 a month, if it's too good to be true, it's probably too good to be true.
Which is Ozempic, correct?
Correct. Yeah, that's the skinny shot. It's very, very. That's what everybody talks about now.
Ozempic. Get it? No, don't. God, Jesus.
Well, no, I mean,
there's a time and a place to use that, but everybody and their mom's like, ooh, I need to lose weight, Ozempic.
Yeah.
What they don't know about that is they need to use it forever.
Right. Well, no. You don't have to stay on it forever.
Okay.
No. The piece that I'm talking about specifically is just the validity of the product. And when you see prices and, you have that skepticism, as you should, if somebody is able, you should vet that provider or that practice on where are you getting your medication from. And, if you quickly see that they're hitting you with the, it's you're not getting quality.
Just making sure you're not in that Breaking Bad situation from cooking in your van. Granted, apparently they made the best of all time because it was a chemist. But,
Right?
because essentially this is chemistry. This is doing this, right? But
wait a minute, chemistry applies to life?
Yeah.
I don't get it.
But yeah, so like, basically like,
do your own research.
Vet your place. And then like, don't just be like, okay, peptides, buy, where. Ooh, this seems like a cool place. Someone you don't know anything about or anywhere, because
it's tough. It's tough too, like you said, with referrals. Is you have AI generation now too, and I'll speak from a consumer. I go on Google and I'll type in, I'll type in anything, and then I immediately go to the reviews, and like, yeah, they have like 1,000 reviews, and I believe that it is illegal to pay for those, but I mean, people get around that.
I think people can offer free product for that, and then it's legal.
Right. So that's where it's like, reviews are another great tool, but if you're able to speak to somebody that and trust, and they've had a good experience, and that's honestly, in my opinion, word of mouth, if you can get that. The second piece is educate yourself, and that way you can have the best conversation in a consult with a provider for you specifically.
The next thing, which has been sitting in front of everybody's face on the table, is something that I want to really like talk about, only because I personally have done this, because it's legal in all sports. You're allowed to use PRP, which is platelet-rich plasma. Essentially, it's your own blood, from your own body. And then also we'll move into something else, which is another regenerative medicine, and which is stem cell. And those are two things that you do, which you've also helped me with doing PRP, and recently we've done stem cell on an old torn labrum. All my injuries are from football. Like, they're just, it's really, I don't have any from like CrossFit, like minor stuff, because we do so much volume, but all of it is old injuries that just never got better. And the cool thing is like PRP is most people don't know a lot about it, and it's very simple science. How you heal is through your blood. Your blood has to move to a certain part of your body to repair. And a lot of these injuries that don't repair, like people's knees, like, yeah, you're not going to repair, PRP is not going to repair an ACL tear. But for instance, like your meniscus.
You just say a seal terry.
Yeah, like your meniscus, which is like a pad in your knee, right? Like that doesn't heal a lot. It can heal, but it doesn't heal most of the time because blood flow doesn't really get there. So like PRP is a perfect opportunity to heal that. So like I'm not gonna sit here and tell everyone about PRP, but you can kind of like what it looks like to have it done, what the purpose is, because like you had a bunch of injuries too, and like it kind of led you like, how can I heal my body better? And kind of just talk about like PRP, what it looks like, what it is, and like how it kind of works real quick, just so people can understand it. Because I'm telling you, anybody out there, like you have a nagging injury that won't heal, like this is the thing.
Right.
Well, hold on. Was that a comebacks reference?
Yes.
Hell yeah.
well versed.
That makes me happy.
So PRP specifically, I'll talk about briefly kind of the science behind it, touching on what you had said. PRP, platelet-rich plasma. Not to be confused with RPR, that stands for syphilis.
Wait, what?
Hold on. No. It stands
for repair, perform, recover.
Recover.
In medicine, yeah, that's
it stands for syphilis.
It does.
Nice.
Medical joke, but I would say that so PRP, platelet-rich plasma, essentially, the science behind it is you're pulling the plasma out of your blood. That is responsible for tissue and injury repair. The way that I can explain it to you is if I were to cut your arm right now and you were to start bleeding and it were to scab and it almost has kind of that yellow scabbing, that is because of the plasma, growth factors, all the type of healing factors that are in your blood. That's what that is. So the idea essentially is we get your blood out of your body. We spin it with this item sitting in front of me called a centrifuge. Basically, it's a big box that just spins your blood and separates it. So I am able to extract what we need, which is the growth factor plasma, and then you put it into. I mean, there's various uses, but for injuries specifically, you're putting it into a place that has decreased blood flow. So the knee, for example, the capsule of the knee. The joint shoulder, we're really looking at like cartilage, things like that. Wrist, tennis elbow, also too, torn muscles, things like that. Or where you have scar tissue, you're reintroducing an injury, but you're giving the body, Superman essentially to come in there and say, hey, let's try to clean up business here. So that's the idea behind it. There's other, benefits that you can use. PRP specifically has the ability to really stimulate collagen production. So one thing that you'll see now is what they call, this is more for a lot of the females if they have made it through thus far in the podcast, it's collagen production in the skin. So vampire facials, things like that, is if you're having vampire blood, that's what that is. If you have acne scarring or, reducing fine lines and wrinkles, things like that, you can put PRP on the face, and then essentially you just do microneedling around areas. But again, similar concept. You're putting growth factors specifically on areas of injury, wear and tear. Time is an injury. Then you're promoting that collagen production there. But I believe I answered your question.
Vampire facial. That's interesting.
Jesus, Dan.
No, okay, I didn't go that route. Honestly, I did. I just have never heard of that. That is fascinating.
You're just not in the med spa.
Yeah, I mean, so like most people would look to like be like, okay, I'm gonna go get PRP because I've had tendonitis, and either it's setting in or maybe it's turned to tendinosis and it's been there forever and it's just chronic and you can't get rid of it,
sure.
Right?
Yeah.
How often would people get injections for this? Is it like a one-time thing, 5 times? Like, what does it kind of typically look like?
Yeah, and this is going to be the typical run of the mill answer that you would hear. Is it varies from person to person, and the reason that I say that is based off of 2 things. One is the person, and 2 is the injury, right? So first, if I had an 18-year-old kid who's just, and one thing that is very important that would is very important to note is you need to be healthy to have a successful treatment of PRP.
Mm-hmm.
So, because if you're not healthy and I'm injecting, like cholesterol filled PRP, yes, you may have some good results, but that's not the, that's not the optimal, way to go about it. But
when you say healthy, are you saying like your guys' level of health, or just like a generic blood work's pretty good, you don't have to be on blood thinners, shit like that?
correct. Yeah, no, generic. It would be more so like morbidly obese, 300 pounds plus, going and
Well, fuck.
Not being 6'3" and above, or
All
being,
right,
you know what I'm
safe
saying?
there.
Like
sedentary lifestyle.
you're
things like
you're
that.
truly obese.
Okay, man.
Yeah.
Yeah, you have bad blood work would be a perfect example. You can also, correct me if I'm wrong, see kind of like blood that doesn't look good.
Yeah, you can. If you draw up PRP and it's hazy, that's a sign of that it's not as good, more of like a straw colored. And if we can get a picture, I mean, I'll post it. But
I was just fucking with you, by the way, Clay. Like, yes, I'm 300 pounds, but
you are a good candidate. Period.
Oh.
Period.
So that was more for just everyone to know, like, you don't have to be Griffin level health or Clay level health to be a healthy individual to do that.
Yeah, I like how you said you guys.
Yeah, not you, ACL Terry. He only has one ACL.
Yeah.
In each knee.
Which is a perfect segue to move on to our next point.
Hypermobile.
Yeah.
Right.
Our next thing we can talk about is like, what is the next like big kicker, which is stem cell, which is very
that's not
I think it's not even that controversial anymore. I think like a lot, it can be ethically argued for a lot of people, but there's different ways to get it right. I just recently got stem cell, and it was umbilical cord, so it's not aborted children, which like I wouldn't feel good having that in my body.
Was drinking?
Jesus.
South Park episode.
Which, so like ethically, I mean, that's donated, right? It's not from, so that's like, for me, I'm okay with that. I can live with that. Also, like, I don't know how far this will go. All I know is every week that, like, since I had gotten that, anywhere between a 5 to 10% increase of like getting healthier. I don't know how far it's going to go. I don't know how much it can heal, because the research on it, there's a ton of research showing that it does heal a lot of these things. The problem is there's 1 million injuries. That means you need 1 million studies, and then 1 million plus, because you need to keep repeating that to show like how long is it going to take, how much can it repair, all that good stuff.
Doesn't sound like something the government would fund due to all that.
But they're kind of, because it's a big moneymaker. Why? Because it works. And I think that just the ethical side for like, how do you get it? How do you use it?
How many times does it work though? That's the question.
I think a lot.
No. I mean, from the standpoint of like how much money can be made off of you across the years to take it.
I think a lot.
That's
not each person, because from what I understand, it's between 1 to 2 shots, and then you should be good.
That's right. That's like that's
right. So like
it's like doing psychedelic assisted therapy.
Right. So then what you're getting at is like, it's not a.
They're not going to make money off.
Let's not solve the problem. Let's treat you forever and ever and ever until you die.
No offense.
I'm just listening.
Yeah.
I'm just listening until I'm called upon.
Yeah. So, what would be the point again where like people would be like, you know what? All right, PRP is great, but this injury's further along, and I need stem cell. Versus like, I guess a lot of people probably don't even know much about it. Like, you can avoid surgeries for a lot of these things.
Correct.
Well, then that's not a billing procedure.
Right. Anyway,
we're going from Super Saiyan to Super Saiyan 2.
Yeah. So again, depends on the injury, right? But one thing that you guys didn't touch on was like the financial aspect of it. So stem cells are expensive, and the price is all over the place, right? So in Georgia, you'll see it anywhere from $3,000 to maybe even $10,000.
in California, I've seen it's 20.
Correct. Now you go over to the West Coast, Yeah, people paying 20. I mean, so it's very this medicine that we're talking about, peptides, hormones, as well as vampire facials, but stem cell, I mean, because the they're paying the money, right? And over in the West Coast, you'll see it anywhere from 20 to 50K for a treatment.
But people are paying this because it works.
Correct. So that's kind of one aspect. As a consumer listening to this, I have an injury. If you're healthy and you exercise, honestly, PRP is a lot more feasible. Same thing. You'll see price variation between $400 to $1,000, not regulated by insurance. Some actually orthopedics will do it, but if you go see obviously an orthopedic and it's done by diagnostic imaging, basically, you can get X-rays and things like that to make sure it's a little more, I guess, accurate of a procedure, but it's at least going to be $1,500. I knew somebody recently that thought it was covered by insurance and then not. So price differential, right?
Damn.
So PRP is more affordable. And going back to that question is PRP, if you're going to get PRP, expect mentally at least 3 treatments. 3 treatments spaced about 30 days. The same can go for stem cells, but according to research, it takes a little bit more time, essentially. So one treatment of stem cell, my therapy, if say example for your shoulder, I'd do stem cell, or I would do PRP first, then I would follow it up with stem cell, and then I would do another course of PRP, right? And it just depends on the injury. So a 3 treatment marker, but with stem cells specifically, it's best in combination with that PRP, in my personal opinion. And you need to kind of assess the financial aspect, but then also is the injury. So if you have bone on bone knee, truthfully, stem cell will help reduce inflammation, but for how long, who knows? But it's not going to regrow cartilage. That's, again, my opinion and from what I've seen and experience, as well as research. But if it's a fresh injury and you want to take that leap and you've discussed it with your provider, stem cell is an amazing, especially the fresher the better, because you already have that blood flow. It's a new injury. Chronic is harder to treat and obviously will take a longer recovery. But the fresher the better. And if you're in a scenario where your doctor's recommending surgery, you got to think about the recovery time is another thing you need to assess.
Well, surgery is expensive. Granted, you have insurance for that, right? But then also, like, you had 2 shoulder surgeries and you were out for...
Yeah, I think it took me 4 months,
right,
something like that.
And essentially, you go in, you get a stem cell injection, and you walk out and go back to your normal life.
And that's the kicker. And that's where I hope to see research develop to where it's like you can truly make those claims. In my opinion, we're not at a point where we can necessarily make those claims. For some people, yes, people do get that result. For others, no. But I don't think that we're there yet in medicine. But if that was the case, and I was 18 and they're like, hey, we're going to cut you for this amount of money and you're going to be in a lot of pain for 4 months, or we can do a stem cell injection essentially with 0 downtime and you'll be better in 30 days. Okay, what's the out of pocket? Sign me up right now.
Right.
If that was the case. But,
right. Well, I think also the other side of a lot of this stuff is, in order to get something proven or approved, especially in medicine, it takes years. Right. Because of how many studies they have to do, how many laws and loopholes, like all the things that they have to jump through. So again, like as you were saying, most of the time, word of mouth is really good because or personal reviews of people that you trust. Correct. Because they'll tell 100%. You honestly what it is. And that's why, like, with me, I'm going along this, and like every week it's a small bit of difference, which is, at this point, I can't call it a placebo because there's a difference each week.
Right. And that's what I was going to say, is something that you specifically should touch on now is, so we did stem cells on your shoulder
3 weeks ago. Yeah.
So close to a month. So yeah, I would say just kind of share your experience with that, you personally.
So kind of what it looks like is like, so I tore my labrum, which is in that capsule in your shoulder. I tore it in the back, in football. And I don't know if you ever watch me lift, you'll notice my left arm doesn't lock out super well. And that's just because that shoulder position, like if that's torn, it means it's not as tight and it will pop a little bit out. So it really affects on how I can lock anything out. And I've been in pain since I tore it, right? I've done a ton of rehab, which you can get away with labral like injuries by doing rehab, but it doesn't heal it. It just keeps all the muscles strong.
Right.
And yeah, I still snatch well over 300 pounds, but it doesn't mean like it feels good. So I've never really wanted to get surgery. I'm not a person that wants to go and get under the knife if I don't have to.
Right.
And PRP have done it. It made it feel pretty good for a little bit, while, but again, that's not going to heal that injury. Especially because like considering it's old. I mean, it may be different if it was super new.
It's
but
a good like grease of the wheels.
Yeah,
basically.
it's essentially just greasing the wheels, right? So with this, it's kind of like a shot in the dark. Let's see, like it's super old. Let's see what it does. And it always hurts to get in certain positions. My muscles stay super tight to protect that shoulder. And like week 1, I'm sitting there and I'm doing my warm-ups and my stretching. And normally just stretching and getting into certain positions is painful. But I have to get there so then I can naturally move and get the bar overhead. So I'm in a good place because they're being tight. So they're protecting it while I'm trying to open it up. And it doesn't want to do it. Well, that first week, like after 7 days, I noticed like it didn't hurt to get into that position. It's still torn, still hard. Like it still doesn't feel great. But getting to that position, that external rotation, just warming up, I was like, I don't feel this sharp, like crazy pain. Like it's not like a stab because that's what it normally feels like. And I was like, okay, maybe that's placebo. Maybe like I go get physical therapy all the time too, once a week. And like that also is doing a really good job of helping. So I'm like, okay, maybe just like we've done something a little bit different. It's starting to get better from that. I don't know. But then week 2, last week, it takes me like an hour and a half to warm up just to snatch. Like if I'm snatching, like it is a whole ordeal. Mm-hmm. So I had to lift at like 10 p.m. at night because of my day. I had to get it in. And I went and just started snatching. And I was like, what is happening? It didn't hurt. I could naturally get there. Part of it, again, was PT. My shoulders were a little bit more open, but like it's staying open longer. And it didn't hurt just to put the bar overhead. And I'm like, this is this happening because of stem cell? Because now this is, again, another 5-10% improvement.
Which is gigantic.
Which is massive.
Which is for you especially.
Nothing's changed for like 10 years. And then here we go.
Well, so yes, that's leaps and bounds. We'll say obviously the 10 years is gigantic, but also putting it in real time. Like think about when you're up at the podium and you're having to perform and you can get an extra 5 or 10 pounds on a specific lift and you win the event essentially.
Right.
Or even just kind of that like that inflammation throughout your workouts, you're able to perform, beyond the injury that you have. So yeah, that's gigantic.
Right. Yeah.
That's gigantic.
And then I would say like, so this week, I would just say like it's a little bit better as well. It's just like, it's these like, again, 5% is hard to like notice unless you're hyper aware of what's going on. Like that's what I am. I'm an athlete. Like I have to pay attention to my body every day. So like I'm sitting there, and again, like those are arbitrary numbers. That's completely just like a subjective point of view. It could be 1% better, but it doesn't matter.
Which is
1% better every day. You're done. Like you're healed. I don't know how far it's going to go. I don't know if it's going to fully heal. I would assume if it does, it's going to take about 6 months. That's my, like, I think like, because it's been so long, I think at the beginning, it might give this big jump increase, kind of, and then just take this slow line to being fully healed, or maybe never fully healed. But if it keeps doing anything, what it is doing right now, like I can't be mad at all.
And also to follow up on what you're saying too, is like we had talked about earlier, is we did the stem cell. We're getting closer to that 30-day mark. It's more so just because I'm here with the centrifuge. But after this, we're going to end up doing PRP on the shoulder as well. Just again following that path of treatment.
Yep. Yeah. I mean, and then so then like it was just kind of keeping it healthy and keep giving it what it needs to keep healing. And we'll see kind of where that goes. But I mean, I do know at least right now for PRP, PRP has helped. I mean, I've done it in my shoulder. I've done it for tendonitis. It's a big bump forward. But these two things are super, super interesting because they've been around, but not like super pushed. And as you like, it's starting to pop up a lot more and a lot more. And you see a lot more like marketing for it, right?
Mhm.
And fortunately, again, same thing. Make sure you know what providers you're going with, because this one you really want to make sure you know what's happening. It's not like you can just go get stem cell. You have to go through other companies that have to go through a lot of legality to get that.
And one specific point I want to give for the people that are listening to this is that you don't see maybe you do see a lot. You may feel like you see stem cell promoted, but because, like I had touched on earlier, it is technically not proven science and still deemed controversial. There is a big legal aspect to where you cannot make these claims from a provider standpoint, or I haven't promoted it as well. You can't make these claims, and you can actually get big fines for basically coming out and saying, stem cell, I'll do, like, it's going to make X, Y, and Z better, because it's not a proven claim. It's technically deemed misinformation. So, with that being said, as you do your, scouting or research or things like that, is that just kind of be weary about what the company specifically says about it, because you would rather someone kind of be honest and also make sure that they're not making these gigantic claims, or you get almost bamboozled into something. And then as well as vetting the product, where it comes from and things like that. Super important.
Yeah.
Doing the research on it, people need to go to something like, those of you watching it, I handed my phone to Clay to check out this article on PubMed.gov. And this is not a promotion for PubMed. It's just an objective, like, has actual information.
What has data?
Huh?
It has data.
Yeah, it has data, but like, this one says it's from 2020, stem cell transplantation, a promising therapy for spinal cord injury. And it has a lot of the stuff in it that we've been talking about.
A lot of the people that I've seen promote this from companies, and a lot of them are outside of the U.S.
Mm-hmm.
For whatever reason, it's easier for them to get around certain laws and rules.
Mm-hmm.
They are promoting a lot more on like the spinal cord injuries, like bulge discs. And the way they're promoting, they're like, this is going to do it. They're just showing like, okay, here was your x-ray, here's your MRI, here's whatever. We're going to show you every 3 months or every 2 months or whatever, what's happening. And you legitimately will see that disc start coming back, and it's not bulging, and now you're not having that pain anymore. Like, this is why it feels good.
Yeah.
That's why your back's good again. And it's almost back to like fully normal.
They're going to need 30 plus years of research on it. Just
100%, 100%.
Right.
And that's kind of why, like, stay ahead of the curve, learn what you can, understand. Knowledge is power. Knowledge is one of the most important things you can have on this world.
Right.
The power is yours.
Jesus.
To make a closing statement on that, my personal opinion, especially on for spinal cord injuries, is those injuries, again, if you ever heard about like spine surgery, they're like 1 year. You need 1 year of recovery. Reason being is the blood flow, again, is so small, it's so sensitive. We use everything for the spine, right? But if you were to ask me based off what I've seen, personal reference, and again, personal opinion, stem cells for, again, depending on the injury, but for like a herniated disc, it works. It really does work. That's personal opinion on that one.
Sure. Yeah. Everyone needs to take that into consideration. But I mean, you're sitting here spitting straight facts, dog. I mean, people do need to do the research quite a bit. But being a complete outsider kind of from this stuff, I've never really fully looked into like the peptide stuff, the stem cell stuff until recently. Like,
it typically takes most people to have like bad experiences in certain areas to be like, I'm sick of this. I need something different. There's got to be something different to help me heal. And that's kind of where I think most people end up being. So just start studying and researching and learning as fast as you can.
Yeah.
But I guess the last thing I know, like one other thing, like outside of all of that, what other things do you kind of do which I'm specifically talking about for the women that want Botox, for people, like what other medicines kind of do you do that help with the cosmetic side? Because I know a lot of people also like that.
Sure. Giving quick information is, so I've been a part of 4 different med spas. So I'm, on the aesthetic side of things, I'm certified in Botox, fillers. You could, like I'd mentioned before, you can do PRP specifically for, the what they call basically the bags under your eyes to give you a more refreshing look. So you can do PRP in that area. We already talked about the science. You can do microneedling. There's also laser genesis, which is essentially kind of, resurfacing your skin. There's one thing that would be a little bit different for me is I can make good recommendations on specific skincare. There's one specific brand that I recommend that actually uses stem cells in their product, and they're based out of California. I've used the product as well. It's pretty crazy. I mean, especially for for men, is we don't. Luckily for us, we don't typically look ourselves in the mirror and like stare at our wrinkles. But I do know, obviously, it's it's a big thing, and so like I'd mentioned, Botox, fillers, PRP, microneedling, lasers. You can also do your skincare regimen, super important, and then peptides as well. They really help with, specifically the one I had mentioned originally, was Samorelin. That's a growth hormone analog that again works on collagen production, and that over time you'll see your skin elasticity get tighter. There's other peptides out there, but just using that one since I had mentioned it. But yeah, there's various different things that you can do, and then obviously from a non-consumable, most importantly is making sure that you are eating healthy, protein, as well as the various vegetables that the majority of the people that are already watching this probably already know, and then specifically water and hydration. There's nothing like drinking a bunch of alcohol the night before, waking up the next morning, looking yourself in the mirror and be like, damn, I look bad. And a lot of that's just because of the dehydration and that recovery aspect. Also, your growth hormone levels being low because your sleep was trash.
Mm-hmm.
So like that's a free thing that you can do.
You mentioned the hangover trying to look in the mirror.
Yeah, you just
not even fucker in the mirror.
You're really not even looking at yourself. You're just kind of side eyeing, and you're like, damn, not looking good.
I hate you.
All right. Well, I mean, yeah. So obviously, I'm sure there's people that are gonna be like have more questions about a lot of this stuff. And one place that you can reach Clay is through his Instagram, which is at OptiLife Medical.
Yep. Yeah. And I don't know if you want to do that or not, but in the caption I can put my contact information.
Cool. Yeah. I mean, and yeah, we'll add that in there for anybody that has questions about all this stuff. He'd be happy to answer you. I mean, on anything, because your health there's such a broad range of everything for your health, and everyone needs different things, especially your environment. Environment's a huge, important part of this. And if you really don't, if you're like, man, like I feel bad, or I need, like, I'm just so tired. Yeah. Like you might be too busy, but there's also ways to help optimize that as well. I mean, life is life. And like, you know what, you got 4 kids, you work 3 jobs, and yeah, you might need a little bit of help. And that's a good question to ask him. Or like if you have injuries and you're sick and tired of being hurt, ask him. There's a lot of different stuff that he's not going to sell you on him. He's going to sell you on what is truly going to help you, and then your choice to decide if that's like the route for you to go or not. But like, yeah, again, or you can also message me too, especially if you want to know more about like PRP or stem cell, or like what is going on with me and how I'm healing. Because it's an ongoing journey too. But he's here in Alpharetta, Georgia, and Roswell area as well. And anybody that's kind of like in the area, even outside the area, I would totally tell you to like go talk to him. He clearly knows a lot about what he's doing. He's also passionate about it because he's come from a background that, like has pushed him towards that. And I think people that are passionate about what they do will always be more beneficial than someone that's just like, here's my job. Right. But yeah, we appreciate it, Clay. As things go on, maybe we'll have you back on.
Hell yeah.
Thank you.